For a closer look at global healthcare spending, I spoke to Klaus Lindpaintner of Thermo Fisher Scientific. He's their Chief Scientific Officer in Analytical Technologies, and he was a speaker at this year's World Health Summit. I began by asking him how healthcare systems rebuild after a health emergency.
There's some infrastructure that's been established or set up during the outbreak that obviously stays on site and is available to the communities and to the government down the line. To maintain it appropriately, obviously added investment is necessary, and this is where, for instance, the recent announcement by the G7 health and science ministers that met in Berlin, actually just, I think it was last week, to provide additional funding to make sure that the kind of infrastructure that will be needed or that is necessary to actually contain these kinds of horrendous events is in place, is maintained, is, if anything, expanded, that there is an ongoing effort in training staff and individuals, healthcare workers, as well as just an overall education effort with regard to the communities at large, which, as you know, was part of the issue why this epidemic spread so rapidly and so violently.
And obviously, when there is an outbreak, it's not just the problem of that nation or that continent. It becomes a global problem, and that's something we saw very starkly in the case of Ebola. In terms of funding, both proactively and reactively, do you have any thoughts on the best model? You know, some countries do it privately, some have state funding, some have federal funding. What have you seen work?
If we look at the overall record of how publicly as well or privately funded healthcare systems fare in terms of healthcare economics, in terms of cost efficiency, then I think the message is fairly clear that while the US spends about 3 times as much on a per capita basis in their mostly private healthcare system and ranks number 11 in terms of overall outcomes, the UK ranks number 1, spending 1/3 of the US. So clearly, when it comes specifically to those emerging economies where only a very, very small minority of the population could actually afford private health care, it would have to be on a national level, I would think.
What is your take on whether or not most countries are really prepared? I mean, Ebola exposed a lot of cracks in a lot of systems, certainly, both in developing and developed countries. But are most countries really prepared for the next health emergency?
Well, you know, it's a relative question. I mean, you can be as prepared as you want. If it really sort of takes you over, then all bets are off. I think we have to do the best we can to have certain infrastructures in place that can rapidly respond if and when something happens. And it's always sort of a cost effect and cost return of investment based question. How much do you actually invest? How much can you afford, particularly in these economies where, as long as they don't have an outbreak, everything else is actually much more important in so many ways because they have so many other priorities. But clearly a certain amount of infrastructure, which I think, as I was saying, with regard to both the involvement of the CDC, with regard to involvement clearly of the WHO, is now being taken hopefully much more seriously than it has been in the past. And you know, we have examples where the response rate has been actually fairly quick, specifically, of course, in more developed nations. If you think about the hemorrhagic E. coli a couple of years ago or 3 years ago in Germany and Europe, there was a fairly quick response in terms of identifying the pathogen, understanding it. MRSA lately also was actually, I think, if you will, a success story. So yes, I think we all have to be very cognizant of the inherent danger of things just flaring up very, very quickly and unexpectedly. And we have to sort of find the proper balance in preparing ourselves to respond quickly, but at the same time not doing it to such an extent where, because of the cost itself, it will sort of fall flat on its face.